Do nose vents work for sleep apnea? If you're struggling with sleep apnea and wondering if nose vents could be the solution, let's break down the facts to help you make an informed decision. Sleep apnea is a serious condition where your breathing stops or gets very shallow during sleep, often due to the soft tissue in the back of your throat collapsing. So, can something as simple as a nose vent make a difference? Nose vents, like Breathe Right strips, are designed to open up your nasal airways. They work by lifting the inflamed nostrils to allow more airflow, which can be helpful during times of allergies, colds, or congestion. However, when it comes to sleep apnea, the story is a bit different. Studies have shown that while nasal dilators can improve nasal breathing, they don't significantly impact obstructive sleep apnea outcomes. For instance, a systematic review and meta-analysis found that nasal dilators did not change the apnea-hypopnea index, AHI, which is a key measure of sleep apnea severity. Another study compared the effects of nasal dilator strips, NDS, with continuous positive airway pressure, CPAP, treatment in patients with severe sleep apnea. The results showed that NDS had no significant effect on polysomnographic parameters, meaning it didn't improve the quality of sleep or reduce the number of breathing interruptions during sleep. However, it did improve somnolence and depressive symptoms, but this was not directly related to the sleep apnea itself. In terms of practical use, nasal dilators are easy to apply and can be used every night. They are placed on the nose, just above the flare of the nostril, and are designed to return to their straight shape, lifting the nostrils to allow more airflow. Despite their ease of use, they do not address the root cause of sleep apnea, which is the collapse of the soft tissue in the throat. So, to answer your question directly, nose vents or nasal dilators do not effectively treat sleep apnea. They may help with snoring or nasal congestion, but they do not reduce the frequency or severity of breathing interruptions that characterize sleep apnea. For effective treatment, other options like CPAP, oral appliances, or even surgical interventions might be necessary. In summary, while nose vents can improve nasal breathing and might be useful for other respiratory issues, they are not a reliable solution for treating sleep apnea. If you're struggling with sleep apnea, it's best to consult with a healthcare professional to find the most appropriate treatment for your specific needs.